So the next one is mitochondrial deficiency. So hopefully that makes sense. This thought pattern where you're able to go through this and understand my thinking and how I do this sort of assessment, basically combining all the data that we have available, the subjective experience with the symptoms, the objective data with signs and laboratory data, and putting those together to determine whether or not someone has a cause. Because as you guys know, in order to resolve fatigue and achieve amazing energy, you have to find all of the causes. Because it's only after you find all the causes that then you can treat all of the causes and really see that difference. So with mitochondrial dysfunction, once again, mark all the symptoms that you have: fatigue, loss of motor control, balance, and coordination, muscle aches, weakness and pains, digestive problems and gastrointestinal disorders, cardiovascular problems, and heart disease. So as you guys may know, mitochondria is the energy center of every cell in the body, and it's in every cell except for red blood cells. But so many of our organs have mitochondria in them. Adrenals, the heart muscle, muscles themselves. So if you're looking, every single one of these things, brain, muscles, this is all basically referring to the organ that has the mitochondria in it. Digestion, so the intestines have a lot of mitochondria. The heart, the pancreas, blood sugar irregularities, hormonal disorders, so the adrenal gland, thyroid hormone, sex hormones. A lot of people, I shouldn't say a lot, but there are some people out there who believe that what some people are calling adrenal deficiency or adrenal fatigue is actually mitochondrial deficiency of the adrenal gland, where the adrenal gland is just not functioning right because the mitochondria are lacking in the gland. Vision loss and other visual problems, so that's mitochondria in the eye and also in the brain. Higher susceptibility to infection, that has to do with its relationship to the immune system. So then the laboratory test to do is the optimal nutrition evaluation, the ONE or the ONE test in urine. And then the levels that you may see will be low glutathione levels, low CoQ10 levels, high levels of lipid peroxidases, or high levels of 8-hydroxy-2-deoxyguanosine. And then I say, in my experience, it's very likely that someone has mitochondrial dysfunction if they have 2 or more of the above symptoms. This can be corroborated by the laboratory data listed, but is not required. So if you have 2 of these, let's say you have fatigue and you have digestive problems, you most likely have mitochondrial dysfunction. And I also say, in general, I have found that everyone with fatigue requires mitochondrial support. It's incredibly important. So then once again, you would mark off yes if you had this, which I believe most of you do. And then we would scroll back up to that page 2, which when you print it out, you're going to have it right next to you as you go through it, and you'll be able to mark that off as you go through this packet.